Namaste, good morning, and welcome you all on this International Yoga Day 2021. So we'll start the yoga session shortly. First, we invite Shivram sir, our HOD, to give an introductory session.
Good morning, everybody. On the 7th International Day of Yoga, we are still in the grip of the coronavirus, but we are almost out of the second wave. And hopefully, this will herald the onset of better days. Last year, during this time, we were deeply in the first wave. Today, we have sort of beaten the second wave back, although it is still there. What we need to remember is that those of us who are lucky enough to be alive, it is our responsibility to improve our health so that, whether we get the virus or not, we have to keep our health better.
This meeting is being recorded.
To come out of this as a more healthy population. So in this regard, I welcome all of you to the practice of yoga today, and hopefully in the next 1 hour, what we start will remain a habit with us throughout our life and make our population a more healthy one. All the best. Go ahead, Praerna.
Thank you, sir. So today, myself, Dr. Praerna, and my colleague, Mrs. Raksha, we are going to take the yoga session. I hope you all join together, as the theme today is Be at Home, Be with Yoga, and let's join together and perform yoga in unison. So before starting, a few instructions. As I think most of you know that yoga should be performed in empty stomach condition, and as it is early morning, so please make sure that you are empty stomach. So general instruction that yoga should be performed every time 4 hours after full meal and at least 2 hours gap after light breakfast or light meal. Very important to perform all the practices within your comfortable limits. Don't overdo or overexert at any point of time. Follow your body and please do all the practices gently, comfortably, and without any jerks. And as this module has been suited to be performed on a chair, so all the practices can be performed sitting on a chair or on the mat as per your convenience. Last but not the least, very important, please perform all the practices in a joyful state of mind, and please be mindfully aware throughout the session, and try to bring your body, mind, and breath in the present moment, integrating them together to reap the most benefits. So we shall start the session with the opening prayer to invoke the divinity within and to bring an environment of peace, serenity, and calmness so that we can perform the yoga practices with a relaxed state of mind. So let's all join together. Gently fold your hands in Namaskar Mudra. Let's start.
Sangachadvam samvadadvam Sambo manansi janatam Deva bhagam yatha purve Sanjanana upasate Sanjanana upasate.
Gently drop your hands. So the meaning of the prayer is, may you move in harmony, may you speak in unison, and let our mind be equanimous throughout from the beginning, and let the divinity manifest in all your sacred endeavors. So today, Mrs. Raksha will be demonstrating and I'll be giving the instructions. So please be seated comfortably on your chair, or you can come in standing position. We start with the loosening practices. The first practice, neck movements. So it has 3 variations. Before going into the practice, a word of caution for people who have cervical spondylosis or vertigo. They should perform it with caution. The first variation, forward and backward movement. So please come in Sthiti. If you are standing, bring 3-4 inches between the feet and gently breathe in and take your head back, bend your head and take it as far as you can within your comfortable limit. Breathe out gently, bend your head forwards till your chin touches your chest. Continue the practice for 3 more rounds. Breathe in, gently come up. Breathe out, slowly bend forward. Breathe in, up. Try to synchronize the movement with your breathing. Breathe out, bend forward. Last round, breathe in, come up. Breathe out, bend forward. Slowly come back to center. Feel the stretch over the back of your neck. Next variation, side bending. So breathe in at the center, normal position, and as you breathe out, gently bend your head towards the right so that your ear comes closer to your shoulder without raising your shoulder. Slowly breathe in, come back to center. Breathe out, bend towards the left side in a similar fashion. Breathe in, back to center. Continue for 3 rounds. Breathe out to the right side. Breathe in to the center. Breathe out to the left. Breathe in, back to center. Breathe out to the side. Breathe in to the center. Breathe out to the left. Breathe in, back to center. Last round, breathe out to the side. Breathe in, center. Breathe out to the side. Breathe in, center, release and relax. Feel the stretch on the sides of your neck. Third variation, twisting of neck. So we breathe in the central position, and as you breathe out, gently twist your head towards the right side, keeping your chin parallel to the ground in line with the shoulder. Breathe in, come back to center. Breathe out, twist to the left side. Breathe in, back to center. Continue for 3 rounds. Breathe out to the right. Breathe in, center. Breathe out to the side. Breathe in, back to center. Breathe out to the right. Breathe in, center. Breathe out to the left. Feel the stretch over the other side of the neck. Breathe in, back to center. Last round. Breathe in to the side. Breathe in, back to center. Breathe out to the side. And breathe in, come back to center. Release and relax. Feel the changes over your neck region. Moving to the next loosening practice, shoulder rotation. Gently raise your arms and place the fingers of your hand on both the shoulders on either side. And now breathe in and raise your elbows and take them back as you breathe in. And when you bring your shoulders in front, breathe out. So make rotatory movement with the shoulder. Continue for 3 rounds in the clockwise direction. In the front, try to touch your elbows with each other. Breathe in at the back, breathe out in the front. Now 3 rounds anti-clockwise, breathing in the similar fashion. Breathing in at the back and breathing out in the front. Let your chest be completely filled in with air as you take your elbows back and feel the stretching at your shoulder joint. Gently stop the practice and feel the changes over your shoulders and in your arms. Next practice, this can also be done in sitting, but better to perform in standing position. So stand with 2 feet distance between your legs. This is called as side bending. A word of caution for people having heart ailments. They can perform this practice without raising the hands over their head. So let's begin the practice. Interlock your fingers and turn the wrist outwards. And then as you breathe in, take your arms over your head. Breathe out and gently bend to the left side from the lower back. Breathe in, come back to center. Breathe out, go toward the left side. Breathe in, come back to center. Breathe out to the side. Breathe in to the center. Breathe out to the side. Breathe in to the center. Breathe out to the side. Breathe in, center. Feel the stretch on your sides. Breathe out to the side. Breathe in, center. Last round, we'll maintain in the final position 5 seconds. Breathe out to the side. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe in, come back to center. Breathe out to the left side. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe in, come back to center. And then slowly release your arms, bring them down. Feel the changes over your back, your flanks, between your fingers, and the changes to your breath. Next practice, spinal twisting. So this practice can also be performed in the standing position only. A word of caution for people having low back pain or disc prolapse, they should avoid the practice. So come in Tadasana, standing pose with 2 feet distance between your legs. And as you breathe in, raise your arms and bring them at shoulder level, palms parallel to each other, facing each other. Now breathe out and gently twist your upper torso and towards the right side, keeping your arms parallel to each other. Breathe in, come back to center. Breathe out, twist your torso to the left side. Let your feet be firmly placed on the ground. Breathe in, come back to center. Continue for 3 more rounds. Breathe out to the right. Breathe in, center. Breathe out to the left. Breathe in, center. Breathe out to the side. Breathe in, center. Breathe out to the left. Breathe in, center. Last round, we'll maintain with normal breathing. Breathe out to the side. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe in, gently come back to center. Breathe out to the other side. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe in, come back to center. Gently bring your arms down. Release and relax. Feel the stretch on your lower back, on your sides, and feel the twist over your spinal region. Next practice, forward and backward bending. So, word of caution for people having low back pain, high blood pressure, or heart disease, glaucoma, they should avoid forward bending. Please practice only backward bending. And people who have undergone recent abdominal surgery, kindly avoid the practice. You can practice with eyes open. So, stand in Tadasana, standing pose with 2 feet distance between your feet, and support your back with your hands placed on the waist region, fingers pointing forward. Breathe in and gently bend backwards as far as you can go within your comfortable limit. Breathe out gently. Let your arms hang loosely on the sides and bend forward as far as you can go within your comfortable limits. Breathe in, gently come up and go back. Continue for 3 rounds. Supporting your back. Breathe out, gently bend forward, letting your arms hang loosely. Breathe in, come up, go back. Breathe out, bend forward. Breathe in, come up and go back. Last round, maintain with normal breathing. 1, 2, 3, 4, 5. Breathe out, slowly bend forward and let your hand and neck hang loosely. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe in, gently come back to center. Release and relax. Feel the changes over your back, neck region, lower back, and the changes to your breath. Moving to the next practice, knee bending or chair pose. Word of caution for people having arthritis or back pain, should do it cautiously. So come to standing position with 2 feet distance between your feet. Now breathe in and lift your arms up, bring them at your shoulder level, palms facing downwards. Now gently breathe out and bend the knees and bring your body down in a semi-squatting position. Breathe in, come up. So continue in this fashion for 3 rounds. Breathe out, bend down, let your arms and thighs be parallel to the ground. Breathe in, come up. Breathe out, come down. Breathe in, come up. Breathe out, down. Slowly come up. Drop your hands, release and relax. Feel the changes over your thighs, your buttocks, your arms, and the changes to your breath. Now we have added 2 asanas which can be done in standing pose. The first one is Trikonasana, or also called as triangle pose. Word of caution for people with BP, high or low BP or sciatica, they should avoid the practice or do it cautiously. So keep your legs apart as far as you can within your comfortable limit. And let's start. Turn the right foot outwards to the right side and left foot slightly inwards. And breathe in, raise your arms on the sides at the shoulder level. And now as you breathe out, gently bend to the right side, keeping the knees straight, and look towards your left hand. Let your arms be in a straight line. Hold the final pose with normal breathing. Do it within your comfortable limits. 1, 2, 3, 4, 5. Breathe in, slowly come up. Now we do the same practice on the left side. Turn your right feet inwards. Left feet, take it towards the left side. And now as you breathe out, slowly bend towards the left side, keeping your knees straight, your arms in a straight line, and look towards the tip of your right fingers. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe in, gently come back to center. Release and relax. Drop your hands. Feel the changes. Feel the stretch over your back, thighs, arms, and the changes to your breath. Next asana, Vrikshasana. So this is also called as Shree pose. So this practice should be performed with eyes open. Word of caution for people having migraine issues, high BP, and acute arthritis should avoid the practice or do it cautiously. So please stand in Tadasana with feet together. Now gently fold your right leg and place your right feet on the inner side of your left thigh, your heels touching the perineum. Try to balance yourself by fixing your gaze in front at one point. And now breathe in and gently take your arms over your head and adopt Namaskar Mudra with both hands. Try to maintain the final pose with normal breathing, fixing your gaze in front. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe out, gently bring your arms down. Release your leg and relax. Feel the changes on the inner side of your thigh, the stretch over your back and the changes to your breath. Let's continue the practice on the left side. Hold your left leg and place your left feet on the inner side of your right thigh, heel touching the perineum. Breathe in, gently take your arms over your head and adopt Namaskar Mudra. Try to balance with fixing your gaze in front. Hold with normal breathing. 1, 2, 3, 4, 5. Breathe out. Slowly bring your arms down and release your leg. Feel the changes to the inner side of your thighs, your back, and the changes to your breath. Now we have completed loosening and asanas part, and we move on to the next part, breathing practices of pranayama. Gently sit back on your chair or on your mat and make yourself very comfortable. So let's begin the pranayama session with our entire awareness and integration of our body, mind, and breath. So we start with the first practice. Let yourself be seated comfortably. We start with bellow breathing or Bhastrika Pranayama. So word of caution for people with high BP, heart disease, low back pain, neck pain, spondylosis, they can do this practice without raising the hands over the head and just doing the breathing part within their comfortable limits. And people who have history of epilepsy or recent surgeries in last 6 months should avoid the practice. So let's begin the practice. Please be seated comfortably, keeping your back and neck erect. Acquire fist with both hands and raise your arms at the shoulder level. Make fists with both hands. And now we begin the practice. Breathe in forcefully while throwing your arms up and opening them. And breathe out, bring the hands down, making the fists again. So like this, we'll continue for 20 rounds in one cycle. Let's start. Gently stop the practice after 20 rounds and feel the lightness over your head region, the cleansing effect of this pranayama in your respiratory tract, and the cooling effect of this pranayama, cooling and calming effect. Continue to watch yourself. Observe your breathing. Once you feel that your breath has restored to normalcy, we'll go for one more round. Let's begin. Acquire fist with both the hands on the sides and let's begin. Breathe in forcefully. Throw your arms up. Breathe out. Bring them down. Continue. Gently stop the practice. Observe the lightness, coolness, and the automatic stoppage or slowing of your breath. Feel all the subtle changes over your face region, in your respiratory region. Feel the calming, cooling, and refreshing effect of this pranayama. You can watch all the changes with closed eyes for better experience, or you can practice with open eyes as well. So moving to the next practice, sectional breathing or Vibhagi pranayama. So basically in this pranayama, we involve all the three lobes of our lungs by acquiring three different mudras, that is Chin Mudra, Chinma Mudra, and Adi Mudra. So we'll acquire three different mudras at different times. We'll start with first Chin Mudra by keeping the awareness on the lower part of your chest, and we'll be doing here breathing in a fashion of like it will involve four components of breathing. So breathing in will be for 6 counts, will holding the breath will be for 4 counts, breathing out for 8 counts, and then holding the breath out for 4 counts. So I'll be doing the counting. Try to follow my instructions, or you can go as per your convenience. If this count is difficult, you find it difficult, you can follow your own count, and that can be in the beginning 4:4:4:4. Here we are adopting a fairly adaptable breathing counts. So let's start the practice. Please acquire Chin Mudra and keep your hands over your thighs. Let your entire body be relaxed. Make sure your back and neck is erect. You can practice with eyes open or closed. Take a deep breath in. Breathe out slowly and completely. Let's begin the practice. Breathe in. 1, 2, 3, 4, 5, 6. Hold the breath. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold the breath. 1, 2, 3, 4. So this was a demo round. We'll continue for 3 more rounds. Please maintain the awareness on the lower part of the chest. Breathe in. 1, 2, 3, 4, 5, 6. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4, 5, 6. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4, 5, 6. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold. 1, 2, 3, 4. Release the mudra, but hold on to the stillness and keep observing your breathing. We move to the next part. Now we'll acquire Chinma Mudra with both hands. So touch the index finger to the thumb and fold the other 3 fingers on the inside of your palms. Keep your palms over the thighs in the upside position. Let your entire body be relaxed. Back and neck erect. Mudra tight. Keep your awareness on the middle part of the chest. Now take a deep breath in. Breathe out slowly and completely. Let's start the practice. Breathe in. 1, 2, 3, 4, 5, 6. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold 1, 2, 3, 4. Breathe in 1, 2, 3, 4. Hold 1, 2, 3, 4. Breathe out 1, 2, 3, 4, 5, 6, 7, 8. Hold 1, 2, 3, 4. Breathe in 1, 2, 3, 4, 5, 6. Hold 1, 2, 3, 4. Breathe out 1, 2, 3, 4, 5, 6, 7, 8. Hold 1, 2, 3, 4. Release the mudra, relax. Keep observing your breathing. Hold on to the stillness. Moving to the third part. Now we acquire Adi Mudra with both the hands by folding the thumb and holding all the other fingers on top of it. Keep your palms rested on your thighs in the upside position. The entire body relaxed, back and neck straight. Awareness on the upper part of the chest. Take a deep breath in. Breathe out slowly and completely. Let's start. Breathe in. 1, 2, 3, 4, 5, 6. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4, 5, 6. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4, 5, 6. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6, 7, 8. Hold. 1, 2, 3, 4. Release the mudra. Keep observing your breathing. Hold on to the stillness. Watch your breath becoming slower and calmer. Moving to the next pranayama, Kapalbhati pranayama. So this Kapalbhati is actually a cleansing practice also, but if done slowly, it can be pranayama. So word of caution for people having high BP, low back pain should do it slowly and cautiously within their comfortable limits. And people who had history of epilepsy, hernia, recent surgery in last 6 months, a woman in their second or third trimester of pregnancy or in the menstrual phase should avoid the practice. So this is done in sitting position. We keep both the hands in Chin Mudra on the thighs, and here we do forceful exhalation and passive exhalation. So exhalation is accompanied with flapping of abdomen. So we'll do the practice for 30 rounds in one cycle. So let this stroke be one stroke in 2 seconds. So we'll do a demo. Please start. So please flap your abdomen with exhalation. So let's begin. Take a deep breath in. Keep your hands in Chin Mudra. Breathe out slowly and completely. Let's start. Gently stop the practice. Feel the lightness over your head region and the cleansing in your upper respiratory region. Try to feel your breath. You can keep your eyes closed throughout the practice, or after the practice, you can close your eyes and observe your breath. We'll go for one more round. So once your breath is restored to normalcy, let's begin the practice. Take a deep breath in. Breathe out slowly and completely. Let's start. Gently stop the practice. Release the mudra. Feel the cooling, cleansing effect of this pranayama and the lightness over your head region, the refreshing effect throughout your body. Keep observing your breath. Feel all the subtle changes throughout your body. And don't forget to maintain a joyful state of mind throughout the practice. Moving to the next pranayama, Nadi Shuddhi pranayama or Anulom Vilom pranayama. It's a cleansing and balancing practice. So here we acquire Chin Mudra with left hand and Nasika Mudra with right hand by folding the index and the middle finger. And we close the right thumb to close the right nostril and ring finger for closing the left. So let's begin the practice. Close your right nostril with right thumb and breathe in from the left nostril slowly and gently. Then close your left nostril, open your right, breathe out from the right nostril. Breathe in from the same right nostril. Close your right nostril, open your left and breathe out from the left nostril. This completes one round. Let's continue the practice for 5 more rounds. You can practice with closed eyes. Make sure that your breathing is gentle, comfortable, and smooth. And try to feel the touch of the air going in and coming out from your nostril as you breathe in and out. Try exertion or overdoing. Let the breath flow naturally, smoothly. Make sure to keep your back and neck erect throughout the practice. Once you finish 5 rounds, gently stop the practice. Keep observing your breathing and continue to be aware of the calmness throughout your being. Last pranayama of the session, Dramari Tadayama. So this practice is can be performed solely or can be performed with Shanmukhi Mudra. So Shanmukhi Mudra, for Shanmukhi Mudra, we take all our fingers and close all the senses in our head region except the nostrils. So use your thumbs to close your ears, index fingers over your eyes, middle finger besides the nostrils, but don't close your nostrils, ring finger and little finger above and below your lips. So close them, take a deep breath in, and as you breathe out, produce a humming sound like that of a bee. So this is one round. Let's practice 5 more rounds. Feel the vibrations and the resonating effect of Brahmari throughout your head region, giving deep relaxation to each and every senses in your head region. With this practice, we move to the meditative mode, starting with Nadanusandhana, Makara Chanting. Word of caution for people who have frequent episodes of headache or migraine should do gentle chantings and feel the soothing vibration. Others can practice a little louder one and try to feel the soothing vibrations and resonance produced as a result of chanting Akara, Ukara, and Makara. So we'll be chanting these 3 syllables, 3 rounds each. So please be seated comfortably on your chair or on your mat. Acquire Chin Mudra with both hands and place your palms over your thighs in the upside position. So take a deep breath in, and as you breathe out, chant loudly Akara, keeping your awareness on the chest region. Let's start. Take a deep breath in. Feel the vibrations in your chest region. You can use your left hand to feel the vibrations. Continue. One more round. Feel the vibrations and resonance produced as a result of Akara throughout your chest region. Now we'll chant Pukara, keeping the awareness on the throat region and feel the vibrations in your throat region. Take a deep breath in. Newcomers can feel the vibrations by placing your left hand over your throat region. Take a deep breath in. Take a deep breath in. Feel the vibrations of Ukara throughout your throat region. Next, Makara Chanting. So in this, you take a deep breath in, and as you breathe out, you produce like this sound. So you can place your hand over your head region to feel the vibrations. Let's practice 3 rounds. Take a deep breath in. Gently drop your hand. Feel the resonating effect of Makara throughout your head region. Next, we chant A U Makara in one single flow of breath in the ratio of 1:1:1 for 3 rounds, and try to feel the vibrations moving up from the chest region to throat and then to the head region. So let's start. Take a deep breath in. Feel the vibrations and resonating effect of Omkara throughout your body, giving deep sense of relaxation to each and every cell of your body. Feel this relaxation over your entire being and continue to be in this state as we are moving into deeper state of relaxation. Sit back comfortably on your chair or on your mat, or you can also lie down if you prefer on your mat. So we'll be doing dhyana or deep relaxation. Make sure your spine is erect and comfortable, your entire body relaxed. You can keep your hands in Chinma Mudra or just open facing upwards, placed comfortably on your thighs or by the sides of your body in lying down position. Your entire body relaxed, arms and shoulders loose and relaxed. Gently close your eyes with a slightly upturned face. Let yourself settle down completely, and now try to follow the instructions as I'll take your awareness to each body point. Just maintain a gentle awareness at those points and relax them mentally, like doing a mental scan. Gently take your awareness to your feet region. Bring your awareness to your greater toes, second toes, third toes, fourth toes, little toes. Now bring your attention to your ankle joints. Slowly move your awareness up to your knee joints. Release and relax. Further moving up, bring your attention to your perineal region. Further move up, bring your attention to your hip joints. Further move up, bring your attention to your navel region. Moving centrally up, bring your attention to the center of your chest region at the sternal point. Slowly take your awareness to your hands. Become aware of your thumbs, index fingers, middle fingers, ring fingers, little fingers. Come to the wrist joints. Gently move up to the elbow joints. Further up to the shoulder joints. Now from both sides, come to the center at the tip of your throat region. Very gently move up and bring your awareness to the center of your forehead between the two eyebrows. Maintain this awareness and the relaxed state. Just be aware of the thoughts that are going in your mind without getting entangled in any of the thought. Just be watchful, observant of your body, breath, and mind, working in harmony, in unison with each other, so that you can enjoy your existence. Be in this relaxed state for a while and enjoy the state. Feel the deep state of relaxation throughout your body, calmness in your mind, slowness in your breath, a beautiful harmony between the three. Gently expand your awareness and feel your connection with others around. Further expand it and feel your connection with all beings around. in the universe. Feel your connection with the nature in harmony and at peace. In the state of deep restfulness and calm mind, let's take a resolve for everyone by themselves that I commit myself to always be in a balanced state of mind. It is this state that my highest development can reach to its greatest possibility. I commit to do my duty to self, family, to work, to society, and to the world for the promotion of peace, happiness, and harmony. हिंदी ट्रांसलेशन, हमें अपने मन को हमेशा संतुलित रखना है, इसमें ही हमारा आत्म विकास समाया है। मैं अपने कर्तव्यों के प्रति, स्वयं के प्रति, कुटुंब के प्रति, अपने कार्य के प्रति, समाज और विश्व के प्रति प्रतिबद्ध हूँ और शांति, आनंद और स्वास्थ्य के संवर्धन के लिए प्रतिबद्ध हूँ। इसी प्रेयर के साथ, इसी संकल्प के साथ we come to the close of the session. Gently bring your awareness to your hands and feet by gently sensitizing your fingers and toes. Let's close the session with closing prayer. Fold your hands in Namaskar Mudra in front of your chest. Let's chant all together. Om
Sarve bhavantu sukhinah. Sarve
Santu Niramaya.
Sarve bhadrani pashyantu. Ma kaschit bhag bhavet. Om Shanti Shanti
Shanti.
Shanti.
Gently rub your hands and feel the sacred energy of this session getting concentrated between your palms, and give this energy to your eyes, your face, neck, shoulders, and to your entire body. Thank you so much. Thank you for joining us. Few announcements.
Thank you, Dr. Praerna. Thank you for joining us. So as part of the IDY celebrations, we have a few other events planned for today. So today we have a guest lecture by Dr. Balachandar Subramaniam at 4:30 p.m. All of you are welcome to join it. You could take a screenshot of this if you would like to keep a note of the Zoom meeting ID. We also have another event planned, which is tomorrow, which is happening tomorrow at 3:30 p.m. And this is a webinar on protective value of traditional healthcare approaches for children. Both of this is open to all of you. You're most welcome to join us. Thank you so much for practicing today. And I now hand over the session to Shivram sir to give the closing address.
Namaste. Thanks, Praerna and Raksha, for a very relaxing session. I didn't really actually realize that the whole hour had gone by. Very nicely done. Thank you for all the people who have joined us. I can see Dr. Gangadhar is here, Dr. Kishore, Dr. Hemant, and many people from NIMHANS, the NIMHANS team. I thank you all for joining us. We hope that next year we will meet in more salubrious surroundings outside. We can all do it together. I request all of you to keep the practice going. and join us for all the activities that we have planned for the International Day of Yoga this time. I request Dr. Gangadhar to briefly speak and hopefully continue to inspire us. PNG sir, please.
Thank you very much. It's been a good memories to come back to NIMHANS on the Yoga Day. I'm very happy that this session went on, and I believe close to about 75 people had logged in into this session. I don't know how many more people had been doing elsewhere in NIMHANS. Yes, today, for whatever the reason, we have done it indoors, and we ought to be doing it outdoors at some point of time. That is what we may call it a celebrative mood has to come back, hoping that next year the COVID will allow us to do this in masses. And I wish the yoga center all the best. And I wish each one who participated in the yoga session good health, and take care of yourself, your family, and your children in particular. Wish you all the best. Dhanyavad.
Thank you very much, sir. So as Professor Gangadhar said, we will definitely meet again, hopefully in better atmosphere next time. Until then, please keep practicing yoga mindfully. Thank you all very much.
Thank you, sir.
Thank you, sir.
Thanks to the Telemedicine Center, especially for helping us with this and many other programs. We will continue our collaboration. And I can see, I thought I saw Dr. Preeti Galgali also from the Indian Academy of Pediatrics, with whom we are conducting the program tomorrow. So all the best for all the programs. Please join us. Thank you.
Thank you. Namaste.